Hi guys, in this video I'm going to talk about how smoking, tobacco smoke as well as vaping can affect your healing response if you've got Achilles tendinopathy or Achilles tear or any type of injury to your Achilles tendon. So for those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment of your Achilles injuries. Have a look at the description of this video if you want a link to our website. Okay, so what's the deal with vaping and smoking? Now, people tend to think that vaping is a lot better than smoking and doesn't hold as many issues with it, that it's actually quite safe to do. But to be honest, when it comes to injury healing and tendon healing, that's not really 100% the case. If your vaping liquid still has nicotine in it, then it may very well be delaying your healing response. And let me explain why. So I'm going to look at nicotine specifically, and then after that, I'll chat a bit more about tobacco smoke and the other things that that's got in it that further affects tendons. So nicotine mainly decreases blood flow in the body. And blood flow is really important because the only way that you can get oxygen and nutrients to an injury site is through blood flow. And you also need it to take debris from the injury away from there. Now, it's even more important for tendons because tendons already has a poor blood supply. That's just how they're made. They don't have massive arteries and things that supply them. So if you're now reducing that even further, you're really messing with the healing response. So nicotine reduces the blood flow in two ways. It makes blood vessels constrict more, so it makes them contract. You know how when your hands are cold, they go all white? That's how it looks when you get vasoconstriction, when the blood vessels closes. And it affects small blood vessels more than large ones. And like I said, tendons don't have very big arteries and things going into them, so they are heavily affected by that. Then also, it makes your platelets more sticky. So then sticky platelets stick to each other and that thickens the blood. And thicker blood has more trouble going through tiny little blood vessels. And now these blood vessels are restricted as well, or constricted as well. So it further reduces your blood flow. Now, that's with regards to nicotine. If you're smoking tobacco, like cigarettes, then, or even just cigars every now and again, tobacco has more than 4,000 toxins in it. And just to highlight two of them, if we think of carbon monoxide and hydrogen cyanide, those two further reduces the amount of oxygen that's available in your blood that can be carried over to the tissue. So now the nicotine has constricted your blood vessels, so it's more difficult for blood to flow. But now these two reduces the oxygen that's available, so you even get less oxygen there. The thing with carbon monoxide is it's really easy to bind to red, or it readily binds to red blood cells. So if you've got carbon monoxide in your lungs, that will bind to the red blood cells rather than the oxygen. So in the end, there's very little oxygen that can be absorbed from the blood. The other way that they can affect healing, and this is specifically important for Achilles tendon ruptures or tears, is that they can reduce the inflammatory response. Now, inflammation is how the body gets rid of the debris and the damaged cells after you have a traumatic injury like an Achilles tear. So if you don't have enough white blood cells or that needs to do that job, then you reduce your healing response. And if for some reason you need surgery for that Achilles tendon, that can become a problem as well, because now you're opening the skin up so you can introduce bacteria, and then you're more prone to infections because your body can't fight it, any bacteria as well because you don't have proper white blood cell counts. But the bit that's really important about tobacco smoke is that it reduces the amount of collagen your body can produce. Now, collagen, your Achilles tendon, that's the main building block, is collagen. So 80% of the Achilles tendon is made up of collagen. Let's put injury to a side first and just think of daily use. On a day-to-day basis, your body is constantly renewing some of the collagen fibers in your Achilles tendons. As they get old, as they get a bit weaker, as we just use them and damage a few. That's quite normal. Everything in the body happens like that. But now, if you've reduced your body's ability to produce new, strong collagen fibers, guess what? You're not going to repair your tendon as well. So if you're now running or you're doing sports or activities that load that tendon, you're more likely to get an injury, like an overuse injury, like Achilles tendinopathy, because you can't actually repair it. Now, there's no research that's specifically linked to Achilles tendinopathy and smoking at this point that I know of, but there's strong research to back up that regular smoking can give you earlier onset of degenerative disc disease in your back for those reasons that I've just discussed. So if we think of injury healing, if you can't produce new strong collagen fibers, then you're really going to struggle to heal from a Achilles tendon tear as well as a tendinopathy, because for both of these, you need to be producing new strong cells. Okay, so what can you do? Will it help if you stop smoking for a short period of time? Yeah, it likely will. So we're not sure about all the components of tobacco smoke, but carbon monoxide can take up to 3 days to fully leave the body. So after 3 days, you'll have more oxygen in your blood, and that will already help your healing. I know that it's difficult to give up smoking because nicotine addiction is really severe, and it may not be about giving up smoking totally, but if you're, for instance, smoking tobacco, making the switch to vaping or to gum with nicotine in it may already be a good option, because then at least you're taking the other toxins out of there. And nicotine has not on its own been shown to affect the collagen turnover so badly. Then also, you could maybe just reduce how much nicotine you take in the day or how often you take it. But as I said, it is difficult to give up smoking, and it's difficult to give up nicotine. So maybe chat to your GP. There are loads of services available these days that can help you make changes like that. And if you don't want to give it up forever, don't give it up forever then, but at least give it up for long enough that you can see better healing with it. So let me know if you've got any questions. And remember, if you need more help with an injury, you're welcome to consult one of us via video call. The link to the website is in the description of this video. Take care.